Filipinos' enduring courage in facing obstacles is remarkable. Always manage to move on after a painful defeat. We see people dying and not being able to go to the hospital. We see children struggling between food and medicine. The situation is not exceptional. The situation is a day-to-day occurrence in the Philippines. Yes, to those who care, the challenges are too urgent to permit complacency. Pero sa patuloy na pagtaas ng presyo sa pagpapahospital sa Pilipinas, may magagawa ka ba? Para sa isang ordinaryong mamamayan, wala tayong magawa. Hihintayin na lang ba natin ang kapalaran kung walang gustong tumulong? There's no doubt that in Canada or other affluent society, people's health care is secure. But what about our loved ones back home? Are they? Sad to say, they're not. As a potent instrument for meaningful change, IMS Wellcare found inspiration on Filipinos' enduring mistakes. IMS Wellcare, isang simbolo ng patuloy na lumalagong puno na may atikain makapag-alay ng walang katumbas na advokasya sa kalusugan para sa mamamayang Pilipino. IMS Wellcare, we started building clinics in remote areas of the country where no one, not even the government, nor the giant healthcare providers would ever dare. IMS Wellcare, we are firm in our noble cause to open the way in delivering sustainable healthcare accessibility to the masses. IMS Wellcare, with over 400 accredited hospitals and clinics all over the Philippines, and 8,000 accredited doctors and specialists who would dare challenge our advocacy. IMS Wellcare, and now we are opening our doors to the rest of the world, inland and across the sea. IMS Wellcare, we are reaching out to our sea workers that whenever they may be in the world, they may be aware that their loved ones in the Philippines is secure. IMS Wellcare, we are reaching out to our land-based workers and all offshore Filipinos in the Middle East, Dubai, Qatar, United Arab Emirates, Yemen, Kuwait, Israel, Africa, Europe, Guam, Hong Kong, Singapore, Japan, the rest of Asia, Australia, the United States, and North America. Whichever there are Filipinos who care about their families back home, a gift of healthcare from all over the world to our beloved Philippines, by our Filipino company to the Filipino homes, from across the seas, from across the borders, bringing back home the warmth, the love, the cares that must remain intact despite
the maternal MMR, maternal mortality rate, the infant mortality rate, which is also addressed in the MDG. And the Philippine government is committed to support this, including the support of the reduction of HIV/AIDS, which is a big problem now. And Davao is one of the top-notcher, no? Because HIV in Davao is one of the top-notcher. Number 1, NCR. Number 2 is Cebu because of the injecting drug users. And of course, Davao because of the men-sex movement. We belong to the category A of HIV in the Philippines. Kaya ina-address talaga. Meron talagang program, which is of course a public health issue. Bakit? Yun nga, ang definition, the magnitude of health problem existing in the Philippines or in the region. That's why it is addressed as a public health. Kasi kung isolate man, ang concern ng health is only a very small isolated area or population, it could not be a public health. Kasi magnitude of the problem. As a public health, okay? So, siguro I cannot give you everything. You should also review Google, di ba, definition of public health. And when you say public health, it's really addressed by the Department of Health with manpower from the physician, nurses, medical technology, sanitary inspector, midwives, medtech, and of course including our community frontline worker, which are the barangay officials. Pero the situation kasi of public health is not run only by the Department of Health. It is now a tie-up between the local government units. Kasi meron tinatawag devolution. So yung health providers in an institution like district health office, city health office, provincial health office, is now with the local government, meaning under the governor, under the mayor. So the Department of Health is run like this office, the Department of Health at the regional level. Which are mother units, the national government. Kasi the Department of Health, Region 11.
So, may head
Meron, Regional Director Abdullah Dumama Jr. Yun ang ating head. Regional Director, Assistant Director,
may mga
Regional Director
yung
Abdullah B. Dumama Jr. Okay, so ano pang next? I-edit mo na lang siguro later. Tapos,
how does public health save lives?
Siyempre. Siguro hindi ko masagot in specific kasi as I said, there is the degenerative, the non-communicable program, and the infectious program. So if you look at the degenerative, there is such a thing as cardiovascular program. See, cardiovascular program. Diba? Usually attached dyan, prevention and control program. Dili diretso program, prevention and control. No? So yung secret word dyan is to prevent and control a particular public health program, whether it's infectious or degenerative. Diba? So yung kanyang key, dyan is the prevention and the control. So for example, cardiovascular program, ano man ang natutulong niyan? At bakit ina-address ng Department of Health? Dahil napakalaki na ang statistics that there is hypertensive, coronary artery, all the heart diseases started with hypertension, mataas yan. So ina-address ng department by preventive. So ano yung ginagawa? BP taking, healthy lifestyle exercises, the food pyramid, chocolate campaign, and then ano pa? Regular blood test, diabetes program. So,
Sa dengue po.
oh, for the dengue, that's fine. There's a program for that, diba? Like 4 o'clock habit, or the dengue brigade. So there's a campaign to prevent and control a particular disease like dengue. Launch monthly in an area so that the disease will not go widely or to control, prevent and control. So depende na yan. So anong program gusto nyo i-focus? Diba? Kung dengue ba, filaria ba, or non-com diseases, diba? Like diabetes or heart diseases, or toxicology, or community-based rehab, or blindness. Depende.
Pero dito sa lugar natin, sabi mo na lack of healthcare ang dito sa lugar natin.
Kasi
Yung sabi mo na lack of healthcare, yung majority or
hindi ko mag-guess ang question. Sige, ulitin mo.
yung sa idea mo ma'am dito sa lugar natin, masabi mo na lack of healthcare, maraming disease.
Yun, I said that the double region is an endemic area for diseases like filaria, malaria, dengue, and re-emerging, meaning to say HIV is that re-emerging, kumbaga, kung noon the data is just acceptable, this time increase na rin siya. So with the data that we can present to you, we have a leaflet for that data. So sabi, let's say, ang question mo is the disease in the area existing? So, titingnan natin ang ating statistics, di ba?
May
Titingnan natin, example, in a particular province, mataas ang malnutrition. So, anong ginawa ba ng provincial government? So, 2 years ago, member siya ng malnutrition Canada. But this time, because of an intervention, na-improve na ang nutritional aspect ng probinsya for a particular age group like school children, no? So, wala na yung mga kwasher-codes, diba?
Like for example, mga na-dengue sa isang hospital, ma-record na yan sa
Yes.
parang percentage na.
Oo, meron. Then, dito, we could also add the rest. The rest natin is under Dr. Tabal. Meron silang data of dengue. Kung gusto niyo, dengue ng particular for this year and last year. But if you want, that's for the whole region. But if you want Davao City, you should go to the city health city. Si Dr. Villaperte. Pero dito, meron. Si Dr. Cleo Tabala. Resto. Ano yung resto? Regional Epidemiology Surveillance. So, doon pumapasok ng mga data every regularly. Ano next? Hindi na ninyo interview si Sir Rudy? Dili na ma-interview si Sir Rudy? Ay, tanong?
Yes. Hello?
Ang last, yung last.
What are the top public health administration?
Oh, anong tingin ninyo? Of course, the dengue for Davao City.
Oh, okay.
Meron ka chikungunya, di ba? The dengue is, the vector would be Aedes aegypti. Chikungunya, the same vector of Aedes aegypti. Same mosquito. Pero yung science yung chikungunya would be different from the dengue. So, i-search mo kung anong definition. Basta isa, mas longer ang chikungunya.
Ano
And then,
makakapatay?
joint pains pa rin meron. Even after 30 days, even
Deadly.
after 4 months, 3 months, meron pa rin pain in joint. But hindi naman siya that fatal. Unlike the dengue. But the same lamok, yung vector.
Same
Aedes aegypti.
symptoms.
Meron pa rin fever, joint pain, body malaise. So, ano pa? What are other diseases in the region? Siguro, you have to review our statistics para klaro talaga. But definitely, HIV is one in Davao region. HIV. Separate kasi ang data ng HIV and the AIDS. AIDS is the full blown. HIV is still the asymptomatic or symptomatic. Hindi pag yun, full blown.
Pero may
Magkaiba.
program po kayo na sinasagawa para ma-prevent ang HIV?
Of course, meron tayong yung information dissemination campaign, meron tayong orientation,
Or barangay lang?
may educational campaign, meron. The different districts, di ba, ang city is composed of districts, 16 districts sa Davao City. So, every district, meron tayong doctor, nurse, midwife, sanidad, medtech. So, yung team na yan, ang nag-handle ng different public health program in that particular area. For example, Kalinan District, Baguio District, Makibato District, yung distrito na yan, mag-handle na mga, yung public health services in the area. Number 1 would be maternal and child health care, di ba? Yung prenatal care. Gets nyo? Then, what pa? Immunization, yung naka-built in na talaga regular yan. Di ba? Every Wednesday. Yung nutrition component. Yung FPRP, the Family Planning Responsible Parenthood, na obvious na makikita sa area. And ano pa? Of course, maybe HWs naman. For the IDC, which is the Information, Education, and Communication. So, kanya-kanyang distrito. If they conduct a mother's class, food handlers class for the sanidad, diba? Kasi yung sanidad, maraming component, 7. Environmental sanitation, 7, diba? Meron tayong vector management, waste management, solid waste management, meron tayong water, diba? Intervention, meron tayong potable drinking water, meron tayong toilet, meron tayong sewage. So, ganun kalawak yung intervention ng every health facility. with the manpower to address the public health. Bakit naman? Public health. Para magkaroon tayo ng healthy Filipinos. Kaya binibigay itong mga different public health services for the children, for the mothers, for the elderly. So, if you want to really get the detail of every program, you have to read one program para makikita na ninyo paano din ang next program. Tapos, rabies, ano yun, filaria, yung lamukan, lumalaking ito. And filaria's endemic in Davao City. Yung lumalaking parang tawag natin yun is the elephantiasis. Popularly known as elephantiasis. But it's really the lymphatic filaria. And one province already declared filaria-free province. Kasi bahagyan din ng ating Department of Health is the disease-free zone. Whether it's a filaria-free zone, it's a rabies-free island like Tamad is the target, or leprosy-free province or town. Hindi na mga campaign.
So every when na siya ginaganap ng mga program?
Every month, pwede tayo. Actually, we have calendar for monthly health events. Hindi pa niyo nakita. Sa baba. May tanong pa kayo kasi I can give you a copy of a calendar, the food pyramid poster para i-give you, the smoking poster, diba? And ang information on HIV. Pero yung data nyo sa statistics, yung the rest to yung gusto nyo yung data only. Ano pa? Wala? Guess na ninyo, ano man, anong masasabi nyo about public health na? Anong year na ba kayo? Siguro dapat alam ninyo anong health design. Alam ba yung konsepto sa health? Ano yun? It's not only the absence of WHO health definition. Not only the absence of what? Illness or infirmity, but also includes something, not only the physical, okay? I-review ninyo yan sa WHO. Definition. Para mapat ninyo dun sa, kung alam ninyo ang definition ng health, then you will also get the public health. Kasi i-combine nyo yan. But the DOH don't run the show by itself. Meron tayong mga partners, private, NGO, NGO. So, kung educational campaign, kung bakuna or EPI nutrition, syempre we tested pa rin. Diba? Kasi sa mga school children. So, may partners tayo. Hindi lang solo plan.
May medical ano sa DepEd?
Medical doctors?
Sa DepEd?
Yes, may doctor, may nurses din sila. In the regional office, just like this office.
Pero bakit ang galing?
Ha?
Ang galing daw.
Maybe because of the integration scheme. I don't know. Kasi mayroon tayong reorganization of government.
Saan yung sila ilagay yung mga?
I don't know. Apply sila for